Today I'm going to introduce to you the current standard practice of care in most dental practices for cleaning patients' removable dental appliances, such as dentures, partials, orthodontic appliances, athletic mouth guards, occlusal splints, teeth whitening trays, etc., within the clinical setting. And that standard of practice is by soaking the appliance in an enzymatic solution and then placing them in an ultrasonic bath. These ultrasonic baths remove the bioburden by using sound waves generated by electrical energy. These sound waves cause a cavitation process by the formation of electrical energy. These sound waves cause that cavitation, and that cavitation causes millions of bursting small bubbles to remove the bioburden. Contaminated clinical instruments are also placed in these baths, such as this one here. Most clinics have larger ultrasonics than one that is demonstrated here. The clinical instruments are placed in these baths to remove the bioburden from the clinical procedures prior to the sterilization process as well. The two current methods that most dental offices use to hold that ultrasonic cleaning solution and the removable appliance is either a plastic type kitchen bag or a glass beaker. So generally, you would take the ultrasonic cleaning solution and the removable appliance, and you would place that in the ultrasonic bath. And as you can see, the ultrasonic bath has been used. So there is condensation on the lid, which also contains the bioburden from whatever is in the ultrasonic bath. The baggie is generally placed over the lip of the ultrasonic cleaner and then placed so that it secures the Ziploc baggie. Ultrasonic manufacturers recommend that a piece of aluminum foil is placed in the ultrasonic bath for 60 seconds. After this, and then running the ultrasonic. And after the cycle is completed, the aluminum foil is removed and is observed for any pinpoint holes. That's an indication that the ultrasonic bath is working. The concern with placing these patients' removable appliances in kitchen storage bags are multiple. If the ultrasonic waves can perforate aluminum foil, it should then also be assumed that this process will perforate the plastic storage bag. And remember, as the ultrasonic is used throughout the day, that water bath is heating up as the steam is coming through. And you can see that that is also going to compromise the integrity of the kitchen storage bag. So these holes that are perforated into that bag, no matter how microscopic, allow the bioburden from the ultrasonic bath to contaminate the appliance that is in the bag. Secondly, when the storage bag is submerged in the ultrasonic bath, with the lid securing the storage bag so that the storage bag won't float free, because like I said, most dental clinics have ultrasonic baths that are at least twice the size as this small one for demonstration. As other clinicians finish with their patient care, they place their contaminated instruments into this ultrasonic unit to remove the bioburden as well. So as they're lifting the lid and placing instruments in there, they might have to readjust this bag, and their hands are not clean from the biocontaminated instruments that they're placing into the ultrasonic bath. So this entire outside of the containers, and as you can see, the condensation and the steam are also created on the outside of this baggie as well. So when this bag is then removed to clean the inside, the appliances, I've now taken my hands and I've touched the outside of the bag and I'm grabbing the appliance, so I'm contaminating those as well. There is no way that you could sterilize or disinfect this bag prior to cleaning or removing those appliances. The second way that clinics do clean removable appliances is with the beaker. Filling the beaker with the water, because you need the water to generate the cavitation to go through the baggie. That is then placed into the ultrasonic cleaner, but as you can see, this beaker floats. It's not heavy enough, nor can it ever be heavy enough. There are some stabilizing units out there, but I've not seen any of those used in any dental clinics that I've worked at in my 30 years of experience. What also happens with this floating beaker is when other clinicians come to put in their instruments to remove the bioburden, and this is floating, it has the tendency to tip if there's not enough water in it. That's also going to allow the bioburden from the ultrasonic bath to then get into the beaker, which is again going to get onto that kitchen storage bag. So if this ultrasonic were larger as well, now you have the cover on it, which has the condensation, which contains the bioburden. That also has the ability to get on the outside of that container or onto the storage bag. So this method as well is going to contaminate the outer surface of this bag, making it impossible to remove the patient's removable appliance without contaminating. Even if you were to remove your gloves and put on a new pair of gloves, there's no way to disinfect this kitchen storage bag. There is another method that I have not seen, but I did research, and that is by putting the removable appliances directly into the beaker. And beakers lids can be ordered for these beakers, but what I found with that is the lid sits inside of the beaker's rim. And what that does is, if there is any drop of liquid along the surface of the top where that is sealed, that liquid has the potential to create a liquid bridge, so that when this is placed into the ultrasonic bath once again to clean, as you can see, it's floating again, and the cover is on there, that cover has the ability to drop that condensation with the bioburden onto the cover of the beaker, which, if there's a liquid bridge, again, those appliances are going to be cross-contaminated with whatever bioburden is in the ultrasonic bath. So there is currently not a process or container system available to dental clinics ensuring a patient's removable appliance will be returned to the patient uncontaminated when they are quote-unquote cleaned at a clinic. For this to occur, the appliance would need to be placed into a sealable, leak-proof container that allows for clinical disinfection of the container after its removal from the ultrasonic bath. Once the container is disinfected according to the disinfectant manufacturer's recommendation, the patient's dental appliance can safely be removed from the container without cross-contamination. So this process has a patent pending, And what this process would do would be to take that enzymatic cleaner once again, and the patient's removable appliance would be placed into that container, and the container's lid would then be securely locked in place. If the clinician has their clean gloves on prior to doing this process, everything here is only touched then by the clinician and the removable appliance, so that the only contamination or bioburden within this container or anywhere on it now is the patient's own. The second container, water is placed into that container, again to create the cavitation through the first container and into the second container to cavitate the enzymatic cleaning solution. And then this cover is secured in place once again with a gasket. And then this system is heavy, it does not float, and now that ultrasonic process is cleaning that patient's removable appliance. Once the appliance is clean, the clinician can take out the container and wash the entire outside off. Then, taking the disinfectant, spraying the entire outside of the container, allowing that to sit, to disinfect the entire outside of the container. The clinician would then deglove and reglove removing the patient's removable appliance uncontaminated from any bioburden from the ultrasonic bath. Again, this container, because this is sealable and leak-proof, only contains the patient's bioburden. So now this container can be open and all of the patient's previous bioburden is removed, and the appliance can be given back to the patient uncontaminated. These units are then sterilized in an autoclave in between patients. This outside container can also be sterilized, or it can be stored in a sink for the remainder of the day to use for other patients who bring in their removable appliances. Each clinic would have 1 to 2 of these removable inserts that they can keep autoclaved and sterilized until the next patient comes in and has a removable appliance.